Blood pressure is the force exerted on the artery wall by the circulating blood. It is measured in millimetres of mercury and involves two measurements, namely diastole and systole. Diastole refers to arterial pressure during ventricular relaxation, whereas systole refers to arterial pressure during ventricular contraction. The mean arterial pressure is the average pressure during one cardiac cycle, and so will include diastole and systole. The components of blood pressure include cardiac output, or the amount of blood pumped by the heart in 1 minute, peripheral vascular resistance, affected by factors such as lumen width and blood viscosity, and the vascular blood volume. Blood pressure regulation involves the neural pathway, the RAAS system, and the hormones anti-diuretic hormone and natriuretic peptides. If we look at the neural pathway first, baroreceptors are stretch-sensitive receptors that are located primarily within the carotid arteries and the aortic arch. They detect pressure changes by the amount of stretch in the vessel walls, and then send these signals to the medulla oblongata, which triggers the autonomic nervous system to respond. If blood pressure is high, the parasympathetic part of the ANS is activated to relax the system by decreasing the heart rate and inducing vasodilation, leading to a lowering of blood pressure. Conversely, if the blood pressure is low, the sympathetic nervous system is activated and heart rate and contractility is increased and vasoconstriction induced to increase blood pressure. Chemoreceptors are located in the brain, the carotid artery and the aortic arch and measure oxygen, carbon dioxide and the pH of the blood and CSF. When the chemoreceptors detect that carbon dioxide is high and the oxygen and pH is low, they will signal the medulla to increase the sympathetic nervous system activity. This induces a raise in the heart rate and vasoconstriction and subsequently a raise in blood pressure in an attempt to improve tissue perfusion. Conversely, when the chemoreceptors detect high oxygen and pH and low carbon dioxide, the sympathetic nervous system activity decreases, leading to a drop in heart rate, vasodilation, and a lowering of blood pressure. The RAAS, or renin-angiotensin-aldosterone system, is triggered by the baroreceptors detecting low pressure, the renal macular denser cells detecting low sodium, or if there is decreased renal perfusion. Any of these events trigger the kidney to release renin into the bloodstream. Renin converts angiotensinogen released by the liver into angiotensin 1, which is further converted by angiotensin converting enzyme, or ACE, into angiotensin 2. Angiotensin 2 binds to specific receptors on the blood vessels, which causes vasoconstriction and thus increases blood pressure. Angiotensin 2 also stimulates the adrenal glands to release the steroid hormone aldosterone, which increases sodium and water retention by the kidney, therefore increasing blood pressure. It also triggers the release of anti-diuretic hormone, which will be discussed next. Anti-diuretic hormone, also known as vasopressin, is a hormone released from the pituitary gland in response to low pressure detected by the baroreceptors, high levels of aldosterone, and high osmolality. It binds to receptors on blood vessels, resulting in vasoconstriction and subsequently a rise in blood pressure. ADH also leads to the insertion of aquaporins in the collecting ducts of the kidney, leading to the reabsorption of more water and therefore a rise in blood pressure. Finally, the atrial and brain natriuretic peptides have a role in regulating blood pressure in response to high fluid volumes and high pressure. ANP is released from the atria and BNP released from the ventricles. These peptides reduce the secretion of aldosterone, suppress sodium channels in the kidney, and suppress the release of renin. All of these will lead to more sodium and more water being secreted, therefore reducing blood pressure. To recap, there are several physiological mechanisms designed to regulate blood pressure, which include baroreceptors, chemoreceptors, the RAAS, ADH, and the natriuretic peptides. These systems use feedback mechanisms to reduce blood pressure or increase blood pressure in order to keep it within the normal homeostatic range.